Part 36, Mask Use in Children. Welcome to the lesson on mask use in children. In this video, we will discuss the steps of mask use in children. Mask use in children. Giving breaths in CPR is generally safe. However, if a mask is available, it should be used. The mask fits over the child's mouth and nose. Many masks have a pointed end, which should go over the bridge of the nose. Make use the mask fits properly. If it's too large, a proper seal cannot be obtained and efforts to deliver breaths will be ineffective. How to give breaths using a mask. Step 1. Place the mask over the child's mouth and nose. Step 2. Open the airway by performing the head tilt/chin lift maneuver. Step 3. Ensure a good seal between the mask and the face. Step 4. Give a breath for more than 1 second and watch the chest rise. Step 5. Deliver the second breath. This concludes our lesson on mask use in children. Next we will review automated external defibrillators, AED, for children.